Welcome to the Marine Corps Suicide Prevention Podcast, where we address the physical, mental, spiritual, and social components of suicide prevention. I'm your host, Dr. TJ Owens, Suicide Prevention Capabilities Section Head with Behavior Programs Branch at Headquarters Marine Corps. In this episode of our Connectedness series, we will discuss normalizing the conversation around mental health. A key aspect of this effort is getting Marines and their families trained on the resources that are available. Today we're going to be talking with Gunnery Sergeant Bianca Davis, who is currently the SPPC for HNHS New River in North Carolina. Gunnery, would you tell our listeners a little about yourself, what you do, and your passion for preventing death by suicide?
Thank you, Dr. Owens. I'm an active duty Marine of 16 years. I am a mom of 3 amazing little boys, and I am currently the staffing CRC of Marine and Family Programs here in Camp Lejeune, New River area. I was able to land this amazing billet by applying for the degree completion program with my undergrad degree in psychology. While I'm in uniform, I fulfill the collateral duties as the suicide prevention program coordinator, where I was able to, gain a little bit more exposure to the increased trends of suicide. So my passion for preventing death by suicide is simply as our numbers are getting higher and higher, and then we have to figure out a better way to attack mental health to reduce these risks.
Okay. I will say to our listeners that Gunny and I had the opportunity to talk a little bit before about this topic. And Gunny, I was thinking about a conversation that you and I had on this topic concerning prevention and education resources. Such resources seem to be utilized for the most part in a reactive fashion or after something has happened. What are your thoughts on this?
I think first and foremost, we have to address the most important thing. We're recruiting from a population that is already breaking records for suicide without the stress of military career. So coupling the demands of military service to this population is already an increased risk for death by suicide. So I think the challenge will continue unless we truly look at ways to mitigate these risks for suicide or mental health challenges. And then we need to really think about the reality of the risk. Like, it needs to be very transparent that the risk is here and it's imminent. But also then afford a safety network for these individuals to seek help. Right? It needs to be normal that you're able to continue to practice your mental health. Right. Almost as normal as hearing someone say that they drink a little bit too much, or they want to practice, have safe sex practices. Like, it doesn't need to be an uncomfortable conversation. It needs to be a comfortable conversation, one that you can have at the dinner table, or at the end of the day for a safety brief.
Okay, thank you for that. And kind of lends to some of my other thoughts on this subject. I've had the privilege, as you might know, of sitting on the Death by Suicide Review Board and reviewing every death by suicide that occurs in the Marine Corps. And doing so, I've come to a pretty good understanding of some of the stresses that are out there, especially those that we capture on our 30-day reports. And I would tell you that relationships, past trauma, and the like, when it comes to these stresses, are the most prevalent factors that contribute to suicide-related events. So how do you think, and coming from your experience and your training and education and what you've seen, we could normalize the conversation around mental health and prevention of death by suicide with these things in mind?
Absolutely. So, just based off my opinion, I think overall we need to just really think about what this means as far as what can we do to just have this conversation just as normal as I said before. any alcohol, problems that someone may have, or a struggle to reduce their run time.
Mhm.
Right? These normal conversations can be just the same when you're thinking about mental health challenges. Right? Prevention and education offers so many different resources, but we're often looking at them as reactionary needs,
Yeah.
right?
Yes.
For decision making by our service members. But in fact, they offer skills to support literally the initiative of total fitness right now,
Mhm.
right?
Mhm.
The concept of what we're saying, physical, mental, spiritual, and social components. They offer those resources to achieve that. So when you're thinking about what that means,
Mhm.
a Marine who came in with a broken home, broken background. We don't know where they really truly came from or what that looks like. Everyone has a diverse upbringing, but we slap them in some training for a few weeks, give them some secondary, post-secondary school, and then teach them to be the war's fighting force.
Mm.
But in reality, that's a physical element that we're giving them, but we really need to teach them how to deal with it once they come back home, or once they transition back to being mom or dad or a brother or a sister. And I think that's really important for us to really sit down and evaluate what that looks like to make that a normal topic.
Very interesting. Yeah, I definitely appreciate that perspective. It's very helpful as we consider the unbelievable challenge that military services in general, especially the Marine Corps, as you point out, America's fighting force, um, have to work with some of these past traumas or issues that a Marine may come in to the service with, and their leaders may not even know about them. I want to go back to something that you said earlier concerning prevention and education. We know that throughout a Marine's career, they have what we call career level education from time to time, not just what they get in boot camp or SOI, but talking about the Sergeant's Course, Staff Academy, and the like as they move through their career, basically grow up in the Marine Corps. How can we use that structure to normalize the conversation?
I like that question and I appreciate it. Just thinking about what I kind of mentioned earlier, and I'll just hit this. Overall, we have to think about mental fitness as a daily conversation.
Agreed.
Just like we mandate PT, good hydration, and good nutrition, once we realize that mental health is not just something we see equally, it's not a skill we can just pick up and then put right back down. Instead, it has to be cherished and practiced without sacrifice, right? So when you're thinking about these career level educations, we can learn warfighting every single one of them. We can learn how to write an award, SIRCOM, NAM, or standard naval letter correspondence. But I think it would be very beneficial to include some of these skills that prevention and education offers, like anger or stress management, and then like other things, relationship, how to establish healthy relationships, maybe even just with your coworkers or your battle team, right, your fire team, but also thinking about financial, right? I know in our conversation we had, I mentioned that no matter what happens in your career, your dependency changed, your location changed, you got to see a financial specialist right now.
Yeah.
We've made that mandatory for you to see a financial specialist. If you get married, divorced, have a kid, get promoted, we want you to see somebody to make sure your money is good. Why can't we do that for mental health?
I agree. That is a good question. But let me ask you while we're on that idea about the career level structure. How could we use that structure to educate Marines and their family members about the resources that are available? You touched a little bit on some of those resources, but how can we use that structure to, and for lack of a better word, push those resources in the direction of our Marines?
I think I've seen, over my time, I've seen resources get invited to different events. But like invite Marine and family programs, community counseling out to your family days so spouses can see it. If you have a spouses night, ensure that those important resources are there so they are aware of what's available to them. when you have your safety stand downs, don't just hit the wickets or the check boxes of what you have to get done because it's on the annual screening checklist, but actually invite those resources out to those safety stand downs so they can get face value with these service members that need it and even their families. Another idea could be PME graduations. Often they're short, we get in and get out, but having those representatives there for those critical times when families will be present would be a good way for the resources to be, acknowledged and used. And even if they don't need them then, they know, hey, I remember I was at that, when you did this. And those people there were from prevention education, and they said they had an amazing, 7 7 principles of making a marriage work by John. And I think we should take that class because we get a free book. And I'm like, that's an opportunity for them to see that. And then I mentioned earlier about maybe incorporating some of these mental health, or I would say mental fitness tools into PME, like making it a curriculum developed that can be taught to the service members during the mandatory periods of training to help them better.
Yeah, nice. Totally agree with that. I most recently had the opportunity to be at a sergeant's course graduation, and it's just as you say, a great opportunity because there's a lot of, communing that goes on after those events, fellowshipping, if you will. And if the resources were there, they could give a pitch during the actual ceremony, and then just standing by to meet and greet, because these individuals, let's just put it in plain language, are going to the next level in their career as leaders. Yes. And the leaders are the ones that you want to know about these resources so they can coach, mentor, basically parent those that they are responsible for, and help them understand that the resources are out there as well. And the last thing I want to talk about this, with the support that Secretary of Defense is providing us through the recently conducted Suicide Prevention and Response IRC, much is being done to address some of the areas that we've been talking about, particularly those policies, trainings, and the initiatives, and the available resources that are out there when it comes to mental health and the prevention of death by suicide. But I will say is that there are still a lot more that can be done, and I would challenge the Marines and sailors to do their part, being educated about the resources and availability of these resources, and passing that information on to your brother, your sister, or even your subordinate at arms. Thank you all for listening to the Marine Corps Suicide Prevention Podcast. I am Dr. T.J. Owens, your host, and suicide is preventable if we empower ourselves and others with the knowledge, tools, and resources to do so. If you want to know how to get more involved in what is going on in the prevention of death by suicide, check out the MNRA webpage at manpower.usmc.mil or contact your command, SPPO or SPPC. If you or someone you know is in crisis or at risk of suicide, reach out, connect with CARE, or call the military crisis line at 988.